All right, welcome to Halitics. So glad to be talking to you today. It is Wednesday, and I'm just so excited to get to see Kristen Grimm. Kristen, you called the program, I don't know, a few weeks ago, and we wanted to set up a full-blown conversation. So thanks so much for joining.
Yeah, thank you, Hal, for having me. Really glad to be here today.
Good. I wanted to get your full lower third there. Healthcare and human rights advocate. We're going to talk about your journey to a full-blown supporter, outspoken advocate and support of Medicare for All in just a moment. But as I mentioned before, I always, and I wish I didn't have to, start my program just with a brief discussion of sometimes it's not brief, sometimes it's long, but today we'll try to keep it brief because we want to talk to you. The terrible situation in Gaza. Latest news, 82 Palestinians killed overnight, and the death toll now close to 53,700. That's official. Of course, the numbers are almost certainly much higher, according to Anadolu Ajansi, and they get that from the Palestinian Health Ministry there. 53,655 identified Gazans killed since October 7th. I mentioned 82 additional deaths yesterday, and we don't excuse, we try to point fingers here as best we can. Since Trump took office, we have over 3,500 killed, 1,500 more children at an almost certain minimum. And, you know, before we get into your journey to healthcare advocacy, I think it's really connected. I think, Kristen, given your history, the deaths of children, that must be particularly painful for you as it is for so many of us.
Always, always. It's every human life is worthy of the dignity of living in peace, apart from war, and it is a violation of human rights for any child to be, murdered for any human being, and especially children, but children and adults are equal in their value for life. It's very important to say that. Of course, with children, they have not lived their lives, but as we were talking earlier, peace is a choice. It is. And we have, I always carry this with me, the Universal Declaration of Human Rights. This is what we need to get back to. This was why this document was written and why the UN was formed, because the world had just gone through these world wars, and there was a portion of the world that collectively said, no more, never again. And we see that atrocities still happen decades later, if not more now, in horrific ways. And I always get back to peace is a choice. It is a decision. And all sides of any conflict must come to a place of saying no more. But that's a heavy lift. That's a heavy lift. Yeah.
I'm sorry to cut you off there for a second. I really wanted, as I know you do, the focus on healthcare, is that included in that universal declaration? Because I don't know the answer. I've certainly heard about it, but is that listed?
Absolutely. It's in Article 25. And how I would just, one of the best things you could buy for yourself this year is a copy, a little book like this. I think everyone should have one. They should be walking around this. We should hand them out to everyone, and we should commit it to memory. And so it absolutely Article 25. And it states, I'll read it to you if you want real fast. It says, everyone has the right to a standard of living adequate for health and well-being of himself and his family, including food, clothing, housing, and medical care and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or the lack of livelihood in circumstances beyond his control. Motherhood and childhood are entitled to special care and assistance. All children, whether born in or out of wedlock, shall enjoy the same social protection. So this is a very specific article that says we basically have the human right to social social security within the sense of housing, all the tenets of basic living standards, and healthcare is certainly one of those things. And to segue into healthcare, so much of our political will in healthcare is not measured in the basic tenets of human suffering. So I believe that since the inception of our nation, we have been normalizing human suffering at every turn. And to go, to any human atrocity, it's always because someone somewhere or a collective group of people are normalizing human suffering, oftentimes on both sides of the conflict. But my awareness of all of this happened not just by reading a newspaper article or just watching the news every night, but it's from my own lived experience. So, and it comes from my own personal story. One of my sons was born with a chronic health condition and problem that caused him to have 25 surgeries, most of them happening in his childhood. So I began my journey to healthcare advocacy on the floors of a children's hospital. And he started having surgery when he was 3, had another surgery when he was 5, and when he turned 12, he was having surgery sometimes every 6 weeks. And I'm based here outside of Nashville, Tennessee, and so the Children's Hospital here said, we can't handle what's going on with your son, but so you need to go to the Arkansas Children's Hospital. So the vast majority of his surgeries were in another state. And by walking the floors of children's hospitals, I had really no understanding of healthcare or a need for healthcare reform. Occasionally something would be denied, like a coverage, a test. But during the recession, things got really hard for us, in a financial way. And our son was going to the emergency room so much. We ended up needing Medicaid. And at this point, there was a time when we needed it for about 9 months. But I had no idea. So our son was on Medicaid for like 9 months, and I didn't even know he was on something called Medicaid. I just thought it was a Tennessee healthcare program that they offered to parents with small children. But fast forwarding through all of that, our son had significant health issues. He was on homebound services where we had a tutor come into the house, and it was provided by the public school system. But during this time, this is when the Americans for Prosperity and the Tea Party movement was starting to really build inroads into the state and do grassroots organizing, and starting to come into school board races and put like $50,000 into a very, seemingly, well-run school board. And so they wanted to come in and try to privatize public education. They were starting to talk about school vouchers. This is around 2014, 2015. And in 2016, I started getting involved in protecting public education in my county. And so I ran a school board campaign, and I got very involved with a grassroots campaign and just put my heart and soul into it. And this is the time when they were coming in with, the scare tactics of the bathroom bills and saying all kinds of horrendous things. But yeah, they put $50,000 into this race. And I'd like to say I'm very proud of the fact that the candidate that I supported and helped run his campaign, we beat the AFP candidate, even though they sunk a lot of money in it. And so I cut my teeth on politics in that school board race. And in the midst of that school board race, I was being, inundated with what was going on here in Tennessee. And when you start looking at one area of politics, you kind of start to hear everything. I started hearing something about Insure Tennessee, which was our Medicaid expansion program here. And it was a Medicaid.
And let me just jump in real quick. That would be under the Affordable Care Act, the expansion plan. Yes. That was contemplated by the Obamacare.
Yes. And so at this time, we have a Republican governor, Governor Haslam. comes up with an Insured Tennessee plan. He's Republican. And so the AFP, the Americans for Prosperity, was headed by Andy Ogles at that time, which Andy Ogles is now in Congress. He was the organizer, the grassroots organizer, who went into every county in Tennessee and mounted a campaign against, the Republican governor. And Haslam pushed forth this campaign twice, and it failed twice. And so,
can I just jump in again, because I want to ask about the politics? Why do you think Tennesseans were persuaded by this, extremist agenda that denied, millions of Tennesseans needed care for their families?
Yeah, so millions would not have gotten covered. Around 300,000 Tennesseans would have been covered, but that's 300,000 Tennesseans that could have been, insured through expansion. But because the grassroots organizing went into every county, and they showed videos, and they had a campaign. And they used tactics that were based in generalized ideological statements that have nothing to do with reality. And it's like, this is going to be big government, and big government is bad, and they're going to get in the business of your healthcare. And they had a campaign that was based on things that had really nothing to do with reality. But they didn't give up, and they kept going, and they went into to the places that a lot of people don't go, and they kept at it, and they had a long game mentality, and they had a lot of money. They had the Koch money. The Koch brothers put so much money into all of this, and we were out organized. That's the bottom line. Yeah.
In retrospect, are there ways that you learned from this experience that can be used to defeat these types of anti-life, anti-human, and I don't use life in the term like in the anti-choice sense, but in the choice of human life, human dignity, as you describe it? Are there lessons learned from this that might be used both in Tennessee and elsewhere to defeat these types of movements?
Yeah, absolutely. And just to reiterate, going back to the story that I was telling, so I learned about Medicaid coming out of a school board race, and I just started deep diving into it. And I'm like, what is Medicaid? What does it do? Right. And so that's how I really became involved in healthcare advocacy. I started going to the organizations that are the healthcare advocacy organizations in Tennessee. You have amazing organizations, the Tennessee Healthcare Campaign, Tennessee Justice Center. And I started going into the Tennessee Justice Center, and I was like, teach me everything you know about Medicaid. I became a volunteer. I started calling Tennesseans, interviewing them on the phone, talking to them about their own healthcare disparities. Then, when you talk to people on the phone, you got to get on the road, and it was a very powerful experience. But I will tell you, I wanted to tell you something, that after I ran that school board campaign, I came down with bronchitis. And this was a real turning point in my political awakening. And in the process of having bronchitis and being sick for like 10 days, I watched this documentary by Ken Burns called The Roosevelts. All right. And I was like, I knew about Eleanor Roosevelt, and I knew about FDR and Teddy Roosevelt, but I didn't really know a lot about the New Deal, what really happened during the Great Depression. And so this was a journey of mine that just took me straight to the Universal Declaration of Human Rights, the UDHR, that took me to Eleanor Roosevelt, who is quite possibly one of the most brilliant political organizers that we've ever had in this nation. And you see her right there on the back of a flatbed truck. She's in Crossville, Tennessee, at the Cumberland Homesteads, a New Deal subsistence homesteading program ushered forth in the New Deal. I think there were about 252 homes that were built in this project. And I started looking at how Eleanor Roosevelt would go to the smallest, seemingly smallest places. And she went to, there was no place too small for her to go where she would hold space with people. And so to give the Americans for prosperity credit. They went to the people. And I believe that the only way out of this mess and the egregious violation of human rights that we still have in this country to this day have to be done at the grassroots level, and we have to go to the people, and we have to hold space and listen to their suffering. So after working, as a volunteer at the Tennessee Justice Center, I got on the road. I advocated for rural hospital closures, held space with Tennesseans, went into tiny little counties and went to RAM conferences, which is remote area medical, and listened to how people are living without healthcare in our state. And I became just an advocate across the states of Tennessee. And I ended up helping individuals who are unhoused get Medicaid. And I went into the public housing community in my own community, in my own county, and became a healthcare advocate for the public housing community here in Williamson County. And
so let me just jump in again, because I'm just wondering if there was, obviously your healthcare story, your family story is very powerful, very moving. Yeah. Were there other, I'm sure there were, maybe you want to just detail another one that was particularly powerful that you heard from other folks, maybe who were less, from more disadvantaged backgrounds than yours, probably often much worse in terms of financial security.
Yeah. There's a woman I will never forget, and I was trying to help her get Medicaid through disability. And she was about a 41-year-old woman living in Nashville, Tennessee. And she was a car hop at Sonic. And she was the caretaker and caregiver for her brother who had disabilities. And she had bone cancer in her leg. She had cancer in her leg when she was I think around 19 years of age. And she had to have an amputation of one of her legs. And she had a prosthetic limb that she was given when she was around 19 years old. And she was like 41 years old, and she still had the same prosthetic limb that she had, the original one that she had. So if you know anything about that, that's just not good. And this is kind of graphic, but I'm going to tell it, because this is how we are normalizing human suffering in this nation. She had not had health care since she had, when she was like 18, I think was the last time she had health. 19 was when she had health care the last time. And her stump had worn a hole through her skin because there was not enough padding, adequate padding. So when I see this picture, I have this picture in my phone of her stump coming through her skin, and she figured out one day that she could roll the skin down and super glue it. These are the stories that must be told. This is just one story. I will never forget that as long as I live. She is walking around making, I don't know how much she was making. I can't remember how she was making at the time by the hour, but, she was relying on tips. But she's walking around, and the fact that she had to figure out, I'll super glue my skin together to create cushion for my leg. It's a gross violation of human rights. I have taken unhoused men to orthopedic surgeons to try to get them to sign off saying that, yes, this individual needs disability through Medicaid and through basically what is SSI. And I had an orthopedic surgeon look at one of these beloved men that I was trying to help, say that he has done knee replacement surgeries in different countries where he thought, there were really bad situation. And he said it's the worst knee that he's ever seen in his entire career. And the reason we don't have a national health plan and a universal health plan is because we just do not have the political will to do it. And it's a choice. It's a choice. Like we were talking before, is a peace is a choice? Well, a national health plan is a choice. It's as simple as that. And to give you a little bit of history, going back to 1935, the Social Security Act happens. It's passed into law. But as it was being lobbied and worked out through Congress, and We have to mention Frances Perkins, who was the first Secretary of the Department of Labor. She's appointed by FDR, President Roosevelt, and Franklin Roosevelt. And before she accepts the position to become the Secretary of Labor, she says, I want Social Security. I want a minimum wage law. And so in the original Social Security's plan and the legislation, there was a national health program put into that bill, but it was lobbied out by, guess who? Do you know who it was lobbied out by?
I'm going to say the AMA, American Medical Association.
Well done. That's right. It was lobbied, and it's continuously. They've lobbied things out. And so in my opinion, that the missing that opportunity in the Social Securities Act of 1935 was one of the greatest public policy failures we've had in this nation.
So I'm just going to put this up because you're talking about why you can see this medical debt is such a, beyond the health issue that you described, the infections and the bone damage caused by the inability to replace a prosthetic device. We're talking obviously millions, billions of dollars perhaps at stake for a few very wealthy, already privileged people. Yeah. That's the whole thing, right? It's just there's a few people who obscenely profit from this system, and they're holding on to it like grim death.
Yeah, I mean it's a choice. The for-profit portion of our healthcare system they rule. They are the lobbyists, and they scare the politicians. And there's a whole another component of why politicians don't have the political will to sign on to Medicare-for-All. So in all my advocacy for Medicaid, I ended up running for the state Senate against the Senate Majority Leader Jack Johnson in 2018. I was asked to run for the state Senate, and at first I said, no, I'm a human rights advocate, I'm a healthcare advocate, I'm not a politician. But I ended up running, and I felt very strongly about running. I ran as a Democrat. I like to say I'm an Eleanor Roosevelt Democrat, and I still say that to this day. And I ran on a platform of protecting and expanding Medicaid. But what I learned in my advocacy and in my political experience of running for the state Senate is that Medicaid, so just to give a little brief understanding of Medicaid and Medicare, Medicaid is a state and federal partnership, and it's managed by the states. Medicare and Medicaid covers pregnant women, children, individuals with disabilities, and individuals through Medicaid expansion who live in some threshold of poverty. And Medicare is what covers seniors and sometimes also covers individuals with disabilities through SSDI, which is basically, a disability insurance for those with certain types of disabilities. So the Medicaid and Medicare portion is like, Bernie Sanders comes about, and with Pramila Jayapal, he's in 2017. I'm like, this is very important that we support this. And I realized that we need a national health plan. To trust the states with healthcare is not working. And I mean, what if we had the Civil Rights Act and we just left it up to the states? I think we all would know right now, this minute, which states would be in it and which states would be out of it, right? So I just believe that we have to have federal intervention. We have to have, a federal position on healthcare. And we have to have laws that cover everyone. Everyone's in, no one is out. So I started an organization in 2019 called Mothers for Medicare-for-All, and did some really some fun and very serious work. And in 2017, Medicare-for-All is passed, and at this time, we have some Democratic representatives, congressional representatives, and we have Representative Cohen, and at that time we had Representative Jim Cooper. And in 2017, they ended up signing on. And so when you sponsor a bill, right, you need people to sign on. They have to co-sign to push that bill forward. And so in 2017, the Republicans had the House. And so it was safe for the centrist Democrats to sign on. So some of them did, some of them did not. And then, as we see, it's a reintroduction of another bill. Every 2 years, the bill comes around. In 2019, Sanders and Jayapal put forth another go at it, right? And this time, members of Congress who signed on in 2017 don't want to sign on again because of what happened in 2019. The Democrats have the House. So I figure, who is impeding healthcare reform? It doesn't matter what side of the aisle you are on. If you're impeding and not signing on, you're in opposition to universal healthcare. So at one point, I just decided, okay, well, we're going to have to start protesting and standing in front of these offices. And so I did that. I, stood in front of Jim Cooper's office. He was the congressional representative here in Nashville. And I stood there for 19 Fridays, and from 8 in the morning till 5 in the afternoon, right in front of his office, in front of his door. And, wasn't successful. He didn't sign on, and then the pandemic happened, and, the rest is history. My organization.
So let me there's so much there. It's so interesting. It's fascinating. I just wanted to sort of delve into a few thoughts I had while you were speaking. One, I was going to ask you, has the Democratic Party moved away from the party of the Roosevelts, who are obviously heroes of yours, but I won't ask have they, because obviously it has. My question would be, how far? I mean, is this, would you say the Democratic Party is just simply unrecognizable from the New Deal, the party of the New Deal at this point?
Well, first of all, I want to say that the New Deal was a pretty conservative piece of legislation, although some people would really argue with that, because there was compromise in the New Deal, right? We have the Social Security Act of 1935, and we didn't get a national health plan in it. And there was compromise. And I would like to say that Eleanor Roosevelt was never satisfied with what was going on in the New Deal. It wasn't good enough. It wasn't covering everyone. There was systemic, egregious racism steeped into how the New Deal was, administered and who it covered and what, it's a very complex thing to say that it was progressive for the day, but it certainly didn't go far enough. And so have we gotten away from it? I think what I like to say right now is what's happening in the country is that it's the art of the deal versus the New Deal. And they want to roll back this current administration is trying to roll back many of those federal protections and guardrails that were started in the New Deal. And incrementally from the New Deal, we have gotten things like Medicaid and Medicare, right? It was Medicaid and Medicare, when it was passed and signed into law by Lyndon Johnson, it was an amendment to the Social Security Act of 1935. It wasn't its own standalone law. It was it was an amendment, right? And so we've done incremental things to get more people covered in healthcare. Medicaid and Medicare drastically restructured our healthcare systems, and we literally do not have the healthcare systems or any hospitals that we have today without the institutions of Medicaid and Medicare, and specifically children's hospitals. We do not have comprehensive children's hospitals in this country without Medicaid. In fact, I like to say Medicaid equals children's hospitals, and if you love children's hospitals, you love Medicaid, right? So it's just then you get up to, we have the Affordable Care Act, we have, and the Clinton administration, they wanted to do what they called Hillary Care. That didn't go very well. And so instead the compromise was we got the Children's Health Program, which was known as CHIP. And then we have the Affordable Care Act coming through the Obama administration. So, as an activist, I sometimes get frustrated with incrementalism, but the truth is, most of these fights and most of these campaigns are done through incrementalism. And as my good friend Andy Snyder, who worked at CMS under the Obama administration, he's like, Kristen, incrementalism. I know it frustrates you, but incrementalism is reality and it's how things are done. So we have a long fight ahead of us, but it's something.
But isn't it fair to say, or is it fair to say that we've gotten incrementally worse in terms of many metrics when it comes to healthcare, and certainly when it comes to inequality, income distribution, poverty rates? It seems like we may well be moving in the wrong direction. And I would just point out, he was not yours, but a Tennessee congressman, maybe he was yours, Bill Frist, and then a senator. He was responsible, I think, more than anyone else for privatizing much of the healthcare system and making it for profit. And that has led to ever greater inequities, expenses, and more bankruptcies and the like.
Yeah, I think that, privatizing the privatization of healthcare it's a problem, and it's, that's a complex question. Is it worse? We didn't have the amount of hospitals that when you look at how many hospitals we had in 1938 and how many hospitals we have now, it's very different. And what kind of, I will say with Medicaid and Medicare being passed into existence, it created hospitals, it built hospitals, it built the hospital infrastructure. The more people we've been incrementally doing better, but it's not an everyone in and no one's out situation. So there are millions of people who have insurance, but they're underinsured, right? And it goes back to the basic thing is that we don't have guaranteed healthcare for everyone as a guaranteed human right. And so we're going to have inequity, and we're going to have egregious situations all over this country. And we don't have a healthcare system that's based in preventative care. And it's based in the for-profit. It's based in the for-profit model. And we're in violation of human rights. This nation is because of it.
Are you at all optimistic? I mean, it sounds like we've been on a merry-go-round, and the same senator and the same congresswoman are leading the charge again, or say they're leading a charge in this 2025 bill. Do you see that going anywhere?
You mean for Medicare-for-All?
Yes.
Yeah. Well, and we don't have the political will to do it. We don't have the political will, so it has to. We have to have people signing on to it, right? So every progressive in Congress, in this, in the House and in the Senate, has to sign on. And not everyone is signed on. And
as you pointed out, there's more buy-in from rank and file Democrats when there's no chance the bill will pass or will be enacted into law.
Right.
So do you see the Democratic Party, to kind of riff on that, as ultimately a potential change agent, or do we need to move beyond the Democrats to some alternative political vehicle?
Oh, I absolutely. Okay. So for me, it just goes back to human rights, and we have. It's a really complicated question, and but I believe that what we have to do is we have to speak truth to power and speak the truth about power. Okay. But what we really need to do is we need to go into the field, and we need to organize with the people in this country. And so I believe that movements happen with the people, and that our leaders follow the people. And what's happening in Grundy County in Tennessee, and in the 10 poorest counties of every state. And, the movement has to happen with the people, and then the leaders will fall into place. But I also think that there's some structural things within the Medicare-for-All legislation that need to be addressed. So in the Medicare-for-All legislation, most of Medicaid is just eliminated, right? And I believe that, and I've lobbied with Senator Sanders' healthcare policy team. And I tell people behind the scenes as much as I can that I believe that to go forward, to get people to sign on, is that we're going to have to keep Medicaid and maybe do this incrementally. And I believe that what has to happen first is we're going to have to make Medicaid a federal program and take it out of the hands of the states. The states have proven again and again that they are not worthy of managing Medicaid. And so in a perfect world, I'd love to see the Medicare-for-All legislation be Medicare for all adults, and then we keep all of our kids on Medicaid until they're 22. So when they're 22, someone turns 22, they're put on Medicare. And I believe that this is a more sustainable path for this healthcare reform journey that we're all on, because just to give you an idea how our children's hospitals are shored up by Medicaid, nearly half of the births in this nation are covered by Medicaid. So nearly half of all of our kids get their health insurance from Medicaid. So we're already halfway there. And what I would like to do is put all of our kids on Medicaid, make Medicaid a federal program, and then do Medicare for all adults. And then on Medicaid, on the Medicaid portion, everything is a universal reimbursement rate, which right now for providers and hospitals, the reimbursement rates for Medicaid are lower than Medicare. This is a major problem. Also, we have this fight going on right now with the current administration trying to defund Medicaid by $880 billion. And they're just getting started, okay? They're just getting started. And so we have all the Medicaid advocates all over the country fighting, and even the Medicare for All advocates are saying we've got to protect, Medicaid. It's so vital to our healthcare infrastructure. But what we've got to do is, it's like, how can we protect Medicaid, but then in the Medicare for All legislation, get rid of most of it? It doesn't make any sense. So I say, let's get on the same page. Let's get the Medicaid advocates and the Medicare for All advocates together. Let's be one big happy family and one big coalition. And it's hard to get Medicaid advocates to support Medicare for All when Medicare for All kind of does away with Medicaid. And I understand that everyone has their own opinion, but this is just mine, and it's based on my knowledge and my understanding of how children's hospitals work. And my son, just to give you a personal story, was having surgery on the day that the Epic computer system had just been up and running for the first day. So Epic does major hospital systems. It's like their whole computer system for a hospital. And so it was just the delay that, the delays that were happening, it was chaos. And 54% of all the revenues for inpatient care for children's hospitals paid for by Medicaid. We have, a vast majority, every baby in a neonatal intensive care unit is put on Medicaid, even if they have employer-based insurance on their 30th day in the NICU. So Medicaid literally runs our children's hospitals. It keeps them fortified. And I'd like to say this, our children's hospitals are the most fiscally fortified hospitals in the United States. And why? Why? Because we have most of our kids are covered. And we have a guarantee. We have a guarantee from the federal government that covers around 65, 70% of the portions of our Medicaid payments.
But that guarantee is under threat from the Trump administration to cut that amount. Right. And I just want to then ask the question I asked in the thumbnail. If the Democratic Party were united, and obviously it is, and as you mentioned, centrist Democrats, and certainly from your experience with Jim Cooper in Tennessee, and many others simply will not embrace Medicare for all or some kind of single payer system or very, very strong, tight Medicaid as well. Would this help Democrats make inroads, or progressives inroads into states like Tennessee, which you correctly point out, I have it blood red in this image, but certainly Memphis is not, I believe is Democratic. Nashville, I believe, is Democratic. But, the state itself read. Would this make a difference politically if Democrats embraced this policy?
Absolutely. Absolutely. And so I believe that conservatism on either side of the aisle is dangerous. Because conservatism is based on isolationism and individualism. And it is conservatism is dangerous. It is. And it impedes progressive reform at every level. So absolutely, people are suffering. How? They're suffering. They are suffering in wage disparities. The federal minimum wage is $7.25 an hour, and that's what it is here in Tennessee. So our state minimum wage mirrors the federal minimum wage, and we go back. The further we get away from the New Deal, the worse things do get, because in 1938, we have the Fair Labor Standard Act, and that was our minimum wage, law that passed minimum wage, which our first minimum wage in this country was 25 cents an hour. All right. And so we've only since 1938 gone up to $7. And they love it. So when a department store or some, big store is basically, saying, oh, we're going to pay you $15 an hour, they look like a hero, right? So when we advocate for these things, and then we don't have an increase in minimum wage, people are hungry, and they are working hard. Most people are hard, just working so diligently to make a living. They're working 2 and 3 jobs, and they're angry because no matter who they vote for, nothing changes. There was a man, I ran my campaign for the state senate out of the public housing community in Williamson County. I launched my campaign from there. And when I was canvassing one day, this man, he was so angry to see me. And I had not met him before. And he's like, I've been watching you, I've seen you around here. And he said, I'm just telling you, he said, no matter who I vote for, nothing on this street changes. And it was a powerful moment in my political experience and my advocacy. He said, no matter who I vote for, nothing changes on the street. And we have to listen to people. And he's right. He's right, because our nation is in violation of human rights at every turn. And I held space with him. And I said, I cannot promise that I can change anything, but I promise that I will represent you when I go up to the legislature. And of course, I didn't win. But it kept coming back. And one of the powerful things about my campaign is that I was walking with the people before I ran with them. And that's really important in our political organizing. And I kept going back to his house, talking to him, tell me about your healthcare story. Tell me about your life, And as he told me his personal story, I took it in. When I was standing during the election, when we were going to the polls, he ended up walking to the county complex, which was almost 2 miles from his house. And he was on a cane. And he walked up to me. I was standing outside the county complex with my sign. And he said, I'm here to vote for you. And he had not voted. The last time he had voted was for Barack Obama.
Yeah, I mean, people just check out because they see no value to voting. It doesn't
changes on their street, and nothing changes in their home. And so we have to do the heavy lifting. And I always say that fear is not a movement. So you cannot fear being primaried. You just have to do what's right. You have to. Well,
I also think if you do what's right, people will respect it. If you do what you really believe, now you might lose some votes, but other people are going to look at you. Look at conservatives, look at Bernie Sanders with respect because they believe he has stood for, he has some integrity and he says what he believes, not what some focus group tells him he should say or what his donors tell him he should say. My issues with Bernie, I don't want to get into, praising him, but I think that's one of the reasons he has a lot of popularity across the aisle. I wanted you to comment on this story. Go ahead.
He's the sponsor of Medicare-for-All. And he's saying everyone's in and no one is out. I mean, when I was standing on the streets holding signs, in front of Cooper's office, people started coming up to me. They're like, who gets this? And he said, what do you have to do? Somebody asked me, what do you have to do to qualify for Medicare for all? You know what I told them? I said, you have to be a human. That's it. You have to be a human being. Are you a human? Yes. Okay, great. You're in. Because that's the way it works. And it's not just, people are like, how are you going to pay for it? Bernie knew exactly how he's going to pay. He knows exactly how we're going to pay. We're going to pay for it now.
We'd save money. We'd have more money in our pockets, even with higher taxes on some.
And then also, one of the things about Medicare for all that doesn't get talked about everyone in and nobody out, is about medical discovery, how we're impeding medical discovery in this nation because we don't have a universal health plan. And, what is the one thing a billionaire can't buy? Do you know?
It's eternity for living forever.
Yeah. Cure for cancer.
Oh, okay.
Cure for a disease. So, you can, even President Trump, he's got all the money and all the power in the world that he wants, or maybe he doesn't, maybe he wants more power, more money. Maybe there's never enough. But he can't buy a cure for his own disease or cancer if he got it, because we are impeding medical discovery at every turn, because we are missing so much science and so much data. And I became very much aware of that in my own fight for universal healthcare reform.
I mean, the Democrats, and just to go to the slide I put up here, the Democrats have done such a poor job, in my view, addressing this problem when they've had some power. They've opened the door for even this, where Robert F. Kennedy Jr. is saying, or Robert Kennedy, whatever, I don't know what he is, the third Jr., whatever he is, he's saying we're going to lower prices. Do you have optimism that could happen? And doesn't that make it even harder for Democrats if it's the Republicans who make drug prices lower, a little bit lower?
Well, I would just want to remind everyone that that Joe Biden signed the Inflation Reduction Act of 2022, and that did give some negotiation power for Medicaid and Medicare to have drug negotiation prices and lowering drug prices, and that was done. And I just think that we have to realize that just a few hours later, after this happened, is Trump signs this executive order saying that he's going to lower drug prices. That has nothing to do with employer-based insurance. And it's just posturing, because in the same breath, almost just a few hours later, they put forth the Republican plan to defund Medicaid by $880 billion. So we have to be realistic about what's happening here. And we have to understand that this current administration is full of posturing and dishonesty, to be quite honest, about, and to be clear. And
it also knows that there'll be lawsuits that are going to challenge his authority to do this, which may well prevent the policy from going into effect, and which he may welcome, as far as we know.
Yeah, but they're defunding Medicaid, and they're going to, we will have massive hospital closures all over this country. Millions of people will lose their health care. Children's hospitals will, be in jeopardy because they're going to, they want to do something called block grants and cap the fundings. They have all these plans. If they could block grant the entire Medicaid program, they would, and that would be a cap, and a cap is a cut. So a cap on federal funding. So whatever they're talking about in regards to what they think they're going to do, he's just saying things, and he's a man with a Sharpie, signing executive orders that really are, pieces of paper that have nothing to do with reality. But the reality of what's happening, what could happen to children's hospitals, county hospitals, every hospital infrastructure in this country, what they're planning on doing will be catastrophic to our healthcare system in this nation.
No question. We've been seeing this for decades now, but this is healthcare bankruptcies. This is not individual bankruptcies, but companies and providers, hospitals. According to the article here in Medical Economics, Kristen, healthcare bankruptcies are down from 2023 slightly, but still greater than average. And I thought this was a very confusing, to be perfectly honest, article in some ways, but I wanted to just present it for this program real quick because it details how providers, especially, and you've mentioned this, standalone rural providers, providers who provide, primary care are under particular threat. And that's even before Trump takes office and determined to slash even further the budget.
So I would say that we all just have to, we have to go back to human rights. For me, it goes back to whatever legislation is out there, we need everyone to support it. We need everyone to sign on. Regardless, we need them to support it. We need to push. We have no traction in any legislation, like with Medicare-for-All, for instance. If people don't co-sign it, it can't even, make it to committee. It's got to go somewhere. And a lot of people don't sign on to it because they're like, well, it's not going anywhere. Well, it's not going anywhere because people aren't supporting it, right? So some people don't want to seem like they're, extreme. We call Medicare-for-All an extremist. I want to be middle of the road. And, what's wrong with being, radical about something? I tell you, like when you see pictures like I've seen and held space with unhoused individuals who've been living on the streets and families who lost Medicaid because of the red tape put up by, our Republican supermajority here in the legislature, and they don't have money to buy an asthma inhaler for their child on the weekend. And so what are they doing? They're going to their friends' houses and saying, can I borrow your asthma inhaler? I mean, these are stories that I've documented and listened to. It's just, we have to have the political will, and universal health care is a choice. It's a choice and it's an action. So you make a choice and you act and you sign on to the legislation. People need to sign on. And where would we be without the radicals? Where would we be without them?
Talk a little bit about that caption I've got highlighted at the bottom. Hospital closures of 117 during the 2019 to 2023 period. How, what does that do for folks, especially in mentions rural areas where we see maybe one hospital that serves, a 200, 150 mile radius or, 75 mile radius is closed. Yeah, what does that do to people?
Well, for some people, it's life and death. It means that, they could go to a hospital 20 minutes away, but now they have to travel an hour and 20 minutes away, and so it's life and death for many individuals. For pregnant women, they go into these hospitals and they have to be, ambulances, get in an ambulance. And a lot of these rural communities that I've done advocacy in, they only have one or two ambulances. And so they have to buy more ambulances because, they have to transport individuals from, their homes to the hospital. And so it's a whole breakdown of the healthcare infrastructure, and people will literally die because we're closing these rural hospitals. I mean, rural hospitals, even though they're small and they really can't handle catastrophic care, they're the lifeline between the transport from the county hospital to, say, a major hospital like, Vanderbilt or, Centennial or another hospital here in the Nashville area. They're the lifeline. They're the lifeline for rural communities. And there's just a breakdown. There's a breakdown in the hospital systems because we bow down to the for-profit, the for-profit section of healthcare, and they're leading the way. And until we get a handle on it, we're going to see more rural hospital closures, especially if they do to Medicaid what they're planning to do. So,
Kristen Grimm with us, healthcare and human rights advocate, one of the founder, I should say, of Mothers for Medicare-for-All. Kristen, you've mentioned that you strongly favor a federal solution, that's really the only ultimately viable way to guarantee all healthcare. But we are seeing, at least in some states, movement that seems to maybe go beyond what the federal government is willing to do here in Colorado. The bill that calls for a study and recommendations towards a single-payer plan has passed and was signed by the somewhat to the center governor. He's not a real lefty, Jared Polis. Does that give you some optimism, or does anything give you some optimism?
Yeah, I think any measure to have everyone in and no one out is a good thing. And it's just part of the incremental process of getting to the other side. I'll be very curious how they're going to fund it without, federal support. Maybe they've expanded Medicaid to the extent that they can. It's just, I know that we tried to, Phil Bredesen tried to expand Medicaid here in Tennessee, and it was really hard to do it at the reimbursement rates at the time. And with the Affordable Care Act, the Medicaid expansion reimbursement rates, they lifted those to 90%. And so I would be very curious to see how they're going to cover people with just the pool in Colorado, and maybe they're going to regulate the cost of healthcare. And so if they're going to do that, I haven't read too much about the legislation, but if
I think it's that there's a task force that's supposed to make recommendations. So they probably don't have the answers to your questions yet, but they're supposed to come up with them.
Yeah, I love it that they're talking about it and that they've passed legislation. If it's a task force, they're going to have to answer all of these questions. I hope that they'll still, all of the leaders in Colorado will still support Medicare-for-All, and that they don't just abandon, the legislation. I just think we have to support everything and be open to it and have good community conversations. And the task force is great. But I would just be really curious to see how that would work in a state. I know that California has also talked about doing that at one time. And if they can do a single payer in a state and come up with a model, they might be the model that even transforms Medicare for all, And so brilliant minds can sit around a table and come up with good solutions. And I think, any kind of program that says everyone is in and no one is out, sign me up. I'm at the table. I'm in support of it. I'm cheering you on, and could be an exciting thing for Colorado for sure.
Or we're talking to Tennessean Kristen Grimm. She is, as the caption shows, healthcare and human rights advocate. Just a few more moments left on Halitics. So grateful, Kristen, for coming on. I am so grateful to you for what you're doing, really. I mean, it's lovely to talk to you, and you're adding so much to the discussion, but I really honor your work to try to make life just a little bit better for folks. Beyond healthcare, we talk about that as a policy that has great appeal in conservative, so-called conservative states, red states, whatever you want to call them. What are some other policies we just sort of maybe brainstorm that you would say, and I don't know if you consider yourself a Democrat, if you're a lawyer, I know you ran for state.
I do. I ran as a Democrat, yeah.
What should the Democrats be doing in Tennessee and elsewhere besides championing one payer, single payer, Medicare for all, whatever you want to call it? What else should they be doing to try to build support for Democratic candidates and Democratic policies?
Well, I think in every area of public policy, we have to be as progressive as possible. And it's, like I said, conservatism is dangerous on both sides of the aisle. So I looked to individuals like Eleanor Roosevelt and how she championed progressive reform in her own party. And, like I said, I like to call myself an Eleanor Roosevelt Democrat. And so you speak truth to power, and you speak the truth about power, and you mobilize. And it's, you base things on this the UDHR, the Universal Declaration of Human Rights. And fear is not a movement, like I've said before. And I've told you when I called in, I said how love is a movement, and we've got to be, filled with love for each other and be as progressive as possible and learn and have an open heart for learning. I used to be very conservative. We didn't talk about that. I cut my teeth on progressive politics through my own lived experiences. And I'd like to say this: people can change, and change is our only hope. Okay.
So I'm going to sort of ask you to speak on behalf of women, or women issue, because this sort of struck me. This Occupy Democrats poster. I just was looking on my Facebook feed today. I saw it. I wanted to just have you comment on this, because certainly in many blue states, there's a lot of, I guess, contempt, if it's not too strong word, people feel for rural voters, for red state voters, for heartland voters, whatever. There's a lot of contempt, a lot of pointing fingers, saying it's their fault, they're racist, they're sexist. And this meme here is that, these two great candidates, these two great women candidates, I'm not saying I agree with this, they lost because they're women. That's the problem. Would an Eleanor Roosevelt, if she were alive today and campaigning, could she win in Tennessee? And is this the issue? Is it some kind of bias or prejudice or sexism or racism in states like Tennessee that's hurting the Democratic Party to the point where they can't win elections?
I think it's all of what you've mentioned, but it's this is actually we could sit here for another hour and talk about this. I mean, it's kind of hard to answer this, and I think we've got like less than a minute.
Well, go ahead. Take a little bit of extra time if you can, unless you've got to run.
Yeah. Well, first of all, people did want Eleanor Roosevelt to run for president, and she said, "I'd rather be chloroformed." So she saw herself as an agitator. And I mean, it's an agitator to move people to a progressive place. And I believe that we have people are suffering. Okay. And so many people stayed home. They didn't vote. And so as a party, we have to come to the table, and we have to figure this out, right? And I believe we have to go to the people, all right? So there were 206 pivot states that voted for Obama twice, and then they flipped for Trump, okay? And I believe that we have to go to the places that we've not been going to, and that there needs to be a massive fieldwork campaign. And I'm actually working on a plan for that. So I'm working on a grassroots movement to go into these counties and hold space with people, all right? And so in my experience of running my campaign out of public housing and in some of the most economically depressed areas in my county, and by the way, my county that I live in, at the time when I was running, it was one of the wealthiest counties in the state of Tennessee. And in order for people to go to the polls, we have to build community and relationships with people. We have to go to the people with love, and we have to listen. And we have to, and then we have to follow up, not just listen, but we have to follow up with action. And we have to come out of Washington, and we have to walk with people. And I will say it again and again, if you walk with people before you run for them, and you're with them, and it's really hard for members of Congress and the Senate because they have to be in Washington. There are just things that they have to do. But this is where the party at the grassroots level, from every level of government, we just have to walk with people. And we have to be as progressive as possible and be bold and not afraid. And not let fear be a movement of being primaried or getting into trouble or being name called or whatever. Stand up and be proud of our policies, and not let ourselves get mired down in polarization, right? So what takes me out of polarization and generalization of movements is going back to human rights and going back to listening to the people and listening to what they have to say. When I was running for the state Senate and doing my advocacy, people were like, "Oh, you're a voice for the voiceless." And I'd like to say there's no such thing. Everyone has a voice. And so my understanding of grassroots organizing done during the New Deal and how they got that was that, there was grassroots organizing in the places like Crossville, Tennessee. You go back to that picture. Eleanor Roosevelt is standing on the back of a flatbed truck. She's the first lady of the United States. It's in the 1930s. She went to people. And I'd like to read a quote because it's one of my favorite quotes, and I'm going to get it right here. I pulled it up to read it to you. And this is the heart of how I believe, how I like to go back to this quote and how I try to live my political advocacy and my human rights advocacy out. And it's a quote from Eleanor Roosevelt, and she states this before the United Nations in 1958. And she says, "Where, after all, do universal human rights begin? In small places close to home, so close and so small that they cannot be seen on any maps of the world, that they are the world of the individual person, the neighborhood he lives in, the school or college he attends, the factory, farm, or office where he works. Such are the places where every man, woman, and child seeks equal justice, equal opportunity, equal dignity, without discrimination. Unless these rights have meaning there, they have little meaning anywhere. Without concerted citizen action to uphold them close to home, we shall look in vain for progress in the larger world." And the most important part of this is, unless those rights have meaning there, they have little meaning anywhere. So my plan is to go to the people, to build a grassroots campaign where we go into the counties that feel like they've been forgotten the most. And we hold space with them. We document the violation of human rights in this country through healthcare, wage disparity, and all of these things. So I'm actually working on a plan for that. You know how everyone's walking around and the Democrats are like, nobody has a plan, nobody has a plan. I'm developing one. And
that's wonderful.
I actually have one. And it's grassroots organizing, and it can be a powerful thing. And
do you have a website right now, or we'll promote one later?
Right now. It's in the process. We're putting it together, and it's grassroots organizing.
Well, when you do, please call me. Let me know so I can promote it, get you back on. We can talk more about this. I mean, anytime.
It's powerful stuff, to go into those places that feel like they're forgotten. And so I think that it's I like to be part of movements that actually bring about effective change. And so little by little, we just keep going, and
we live in hope. Thank you so much, Kristen.
We live in hope. Yeah. Mm-hmm. And remember, people can change, and change is our only hope, right? But people do change. A lot of times we lock people into boxes, and they're never going to change.
I get so frustrated at the Democrats and progressives who blame everyone else for losses rather than say, okay, well, what did we not do correctly? How did we not reach out? How did we not persuade people? What are areas where we can do better? I think people have to look inside themselves first if they're going to bring about.
Yeah. And I also want to say this, I hear what you're saying, but I also have a lot of gratitude for people people who run for office, and our Democratic leaders, and our, listen, how have you ever run for public office?
No, I kind of did, actually, since you asked. I did run for a county Democratic Central Committee. So that was considered, I guess, an public office of sorts. And I did not win.
As a politician running for this, for Congress or the state Senate or county commission. So it takes, when people run for public office, it takes a lot of courage, and it takes, sometimes it's a lot of work to run for public office. And so I always like to say that, we call our leaders on the carpet for what what they're not doing. But I do want to say about my Democratic friends who run for office and who are up at the state legislatures every day, every weekend, they're working tirelessly. All my friends that are elected to political office, they're working sometimes 80 and 90 hours a week. And we're all growing and we're all learning together, right? And so I really honor the work that Kamala Harris did, and all of anyone who is running for public office, especially as a woman. It takes a lot of courage. You're constantly trying to figure out the best way to run your campaign. Were mistakes made? Sure, absolutely, because people are human, right? And so it's like sports, okay? So you win some games, you lose some games, but if you keep losing a game over and over again, what do? You go back and you have a meeting. You say, okay, let's look over these plays and let's not do that again. And I think that that's where we are as a party. We're having these conversations behind the scenes, and we're saying, hey, let's come together as a team, let's work together. Let's see what's not working and let's get a plan. And we go out in this game, in the next electoral cycle. I fully believe that we will have a plan, okay? And we will have a game plan. And we may not do that in public, but that's a good thing, right? We're having our family meetings, we're talking. And instead of, hurling insults at people or being unkind, we've got to cheer people on, because what happens at the next game, right? The next basketball game, the fans get out there and they're cheering them on. They want to see them win. And not to minimize what's going on in the world by any means, but it really does matter who is in the presidency. It matters who's in Congress. And I would rather have I'd support a candidate that is incrementally trying to progress human rights than someone who doesn't believe in them at all, okay? And someone who is actively trying to get rid of things like the Affordable Care Act, which it's not enough, right? It's not enough, but it's something. So that's what I'm saying. Conservatism on any side of the aisle is dangerous. However, people who are in the trenches every single day, they are, I believe, most politicians are doing the best they can. And on the Democratic side, and can they do better? Absolutely. But I'm going to support my team. And I believe that incrementally, the Democrats are progressing human rights slowly, and they're going to get better over time. And I think that this whole Donald Trump winning again has been a reset for all of us. And I just, I will say this. I believe in my team, and I believe in doing what Eleanor Roosevelt did. She believed in her team, but she called everyone on the carpet when they were not, fighting for what was right and signing on, And there's a lot to be learned from her legacy and how she went up against the status quo. She called out racism. As the First Lady of the United States, she called for an anti-lynching bill, and she was a bold agent for honesty, right? So I just think that we have to go ahead together. And in the words of Eleanor Roosevelt, so she says, we go ahead together or we go down together. All right. And so.
Well, thank you so much, Kristen. Really appreciate it. Great words, really inspiring. And I hope to talk to you again soon. I just want to let listeners, viewers know I will have, tomorrow should be Halitics with Carlos. Looking forward to that. And then the Free for All on Friday. So enjoy your afternoon. And again, Kristen, don't be a stranger. Hope to see you again soon.
Thanks, Hal.
All right. And that'll do it for Halitics today. Don't forget, by the way, like and subscribe. We need more viewers, more listeners, and more subscriptions.